Hi, my name is Kaylee, and I, along with Julia, are occupational therapy students at the University of Pittsburgh. First off, we want to congratulate you on your new baby. Welcome to motherhood. This video is full of tips and tricks to help you transition into this next stage of life with your little one.
Hello, I'm Julia. First, I'm going to discuss with you how to pick up and hold your baby. First comes picking up. You should always support the head and the neck of your baby because of how fragile your little one is. I'm going to be using this teddy bear as an example. So you can do this with one hand and slide your other hand under the baby's bottom and the other around your baby's neck and head. Once you feel secure in your handling, bring your baby up to your chest. Next comes holding and cradling your new baby. Rest your baby's head against your chest and slide the hand that was under their bottom to behind their neck for support. From there, you can place the baby's head in the nook of your arm. Then bring the hand that was under the baby's head down to their bottom. This is just one way you can hold your baby. You can also hold your baby over your shoulder with one hand on their bottom and the other behind their neck for support. A final note on safety when it comes to picking up and holding your baby. Move with slow and gentle movements and avoid fast jerking motions. When going up and down stairs, hold your baby close to your chest and move very carefully. Finally, avoid carrying hot drinks and other harmful items while also carrying your baby to avoid any injuries.
One of the first decisions you will face as a new mother is choosing whether you want to breastfeed or bottle feed your baby. Newborns only need either breast milk or formula in their diet. You will need to feed your baby about every 2 to 3 hours. There are a few things that your baby may do to let you know that they're hungry, like bringing their hands to their mouth, sucking on their fingers, or crying. Your baby will also let you know when they're feeling full by doing things like closing their eyes or their mouth, turning away from the source of the milk, whether it be the breast or a bottle, or stopping or slowing the rate at which they're sucking. If you notice any of these signs, try taking a break, burping your baby, or just waiting a few moments, and then try to continue the feeding. If these signs continue, your baby is probably full. Additionally, if you're trying to breastfeed and it's just not working out, don't worry. While breastfeeding is an excellent option, so is bottle feeding, and all that really matters is that your baby is being fed. To ensure that your baby is getting proper nutrition, check in with your pediatrician to make sure that they're gaining weight at a normal rate. After your baby is 5 days old, there are 2 milestones that you can look for to see that your baby is eating enough. The first is that your baby should have at least 6 wet diapers each day. The second is 3 or more bowel movements each day. If these things aren't happening, don't panic. Just check in with your pediatrician to make sure that everything is okay. A great benefit that comes along with feeding your baby is the connection that it creates. Try to enjoy this time and really bond with your baby. Kangaroo care is something that you can consider trying to bond during feeding. This is skin-to-skin contact between mother and baby. It doesn't matter if you're breastfeeding or bottle feeding, you can do this. Kangaroo care is when the mother and the baby are both bare-chested while feeding. You hold your baby, who should only be wearing a diaper, to your bare chest after feeding and while burping. You can do kangaroo care as often as you would like.
After each time you feed your baby, and often in between feedings if they are fussy, you should burp your baby. There are several different positions that you can use when burping your baby. First is over the shoulder, as we previously mentioned. This is when you have one hand on your baby's bottom and the other is gently used to pat their back. The next position is face down. Place the tummy of your baby across one of your legs and the head is on the other. Turn sideways. Finally, you can try burping your baby sitting up. Have your baby in a seated position, leaning forward slightly. Support your baby's head and chest with one hand and pat your baby's back with the other. Here are a couple tips for when it is time to burp your baby. You will always want to keep a burp cloth or a towel close because you never know when your baby will decide to spit up. Also, try patting your baby on the left side of your baby's back. This is where the stomach is. Now we will discuss how to properly diaper your baby. First, you will lay your baby down on their back and remove the old diaper. A tip is, if you are throwing the diaper into a garbage can, try placing it in a plastic bag first to avoid making the room smell. Next, gently clean your baby where the diaper is, making sure to clean between the folds of skin. For this step, you can use gentle diaper wipes or a wet washcloth. Make sure you wash front to back. If you notice that your baby has a diaper rash, apply some diaper rash ointment or barrier cream on the irritated area. Now you're going to want to gently lift your baby's legs and lower body by the ankles and slide the clean diaper underneath them. Once the diaper is underneath your baby, lower them back onto the ground and pull the front of the diaper up between your baby's legs. Lift the wings of the diaper on both sides of the baby and stick the stretchy fastening tape found on each side onto the front of the diaper to close it. You want to make sure that you don't fasten the diaper either too tight or too loose. You should be able to comfortably place 2 fingers between the diaper and your baby's stomach. Another tip for you is to turn the cuffs of the diaper around your baby's legs outward to prevent any leaks. Finally, wash your hands and clean the diaper changing area and you're all done.
There are a few key items that you will need to keep your baby clean and healthy while bathing. These include a clean washcloth each time, cleanser, a blanket or a towel, lotion, a fresh diaper for after bathing, clean clothes, and warm water. Also, if you have a baby boy who is not circumcised, you should also have Vaseline and gauze handy. When you first start bathing your newborn, you will want to sponge bathe, opposed to using a tub. First, undress your baby, leaving them only in a diaper. To keep your baby warm, keep them wrapped in a towel. Take the towel off one body part at a time as you clean that part. You want to make sure you clean the neck, elbows, knees, behind the ears, and between the fingers and toes with warm water and cleanser. Then, wash your baby's hair with only water. You should try to do this part after the rest of your baby's body has been washed, as it makes your baby cold. Once you finish those steps, remove your baby's diaper. Then, wash their belly, bottom, and genital area. Make sure to wipe from front to back for a little girl. For an uncircumcised boy, ignore the foreskin while bathing. For a circumcised boy, do not wash the head of the penis until it has fully healed. Finally, pat your baby dry and put some fresh clothing on them. Once your baby's umbilical cord has fallen off, and if applicable, the circumcision has healed, you can safely bathe your baby in a baby bathtub. However, if they don't enjoy the tub, you can continue to sponge bathe and try again in another week or so with the tub. You can also use a sink if you do not have a baby bathtub. Just be very cautious and ensure that it is thoroughly cleaned before bathing your baby in it. To bathe your baby in a baby bathtub or the sink, begin by filling it with warm water. Then, put your baby in the tub, supporting their head with one hand. Wash their face and hair first with a washcloth, then rinse. While doing this, make sure to protect their eyes by placing your hand across their forehead. Then, you can wash the rest of your baby's body with a small amount of soap. While your baby is in the tub, keep them warm by spooning water onto their chest with your hand. Then, pat dry and apply some gentle lotion to their body.
Now we will talk about swaddling your baby. Swaddling helps your baby sleep more soundly and creates a feeling of calmness. It is easier to try and swaddle your baby when they are calm or even drifting off to sleep. Once you're finished swaddling, you want to check to make sure the swaddle is not too tight and tight enough. To do this, you should be able to comfortably slide 2 fingers between the baby's chest and the blanket. Also make sure there's enough room for the baby to kick and move their legs and that the bottom corner of the blanket wasn't pulled too tight. It should be noted that not all babies like to be swaddled, and some will be very, very squirmy. If you decide that it's just not working, remember that it's unsafe to use regular blankets in the crib as it can strangle or suffocate your baby. It takes some practice, but swaddling can be a very useful tool for helping your baby sleep longer and deeper, giving you a chance to do the same. Here's a quick video from UPMC that shows you a way to swaddle your baby.
Alright, Dad, I'm going to teach you how to swaddle. So first you want to fold down this corner, then you want to line his shoulders up right here. And you want to bring his hands together in the middle and then bring this as far over as you can. And then take the corner and wrap it right under his shoulder there. You're going to do the same and try to tuck his feet up nice and tight so he feels like he's back in his mom's belly. And you're just going to fold this right back over. You can roll him a little bit and tuck it under him so he stays, just like that. Then you want to swaddle him so it promotes safe sleep, so he sleeps on his back and they feel safe and nice and tight together like they're still back in their mom's belly. Now your turn. put his shoulders right on that
Right
straight
on the
edge.
line.
Yep.
Starting here?
So start here and fold that as far over under his shoulder. Try to make it nice and tight though. Good. Now hold it there because he'll break out of it. And now pull this up and tuck it right under his shoulder too.
Legs.
Yep, crunch his legs up. Then you're gonna take this and just wrap it all the way around him. There you go, perfect. Good.
To ensure that your baby is safe when sleeping and that they sleep soundly, they should be placed on their back, not on their side or stomach. It is recommended that your baby sleeps in your room in a crib or bassinet for 6 months to 1 year to avoid the risk of sudden infant death syndrome. The baby's crib should be a firm surface and should not have any blankets, toys, or bumper pads until at the earliest 1 year old. This is just a quick way to help you remember the safest way to have your baby sleep, the ABCs of safe sleep. A, alone. Your baby should sleep alone with no toys or other blankets or pillows in the crib. B, back. The baby should sleep on their back. Finally, C, crib. The baby should sleep in their crib, not in an adult bed, sofa, or any other surface.
There are multiple resources around the Pittsburgh area for new moms and their babies. One of these resources is Genesis of Pittsburgh, located in Bellevue. Genesis is a maternity care, adoption, and social service agency. They provide programs and services such as housing, education, counseling, and supplies needed by expectant and new mothers, such as formula, baby clothing, and cribs, free of charge. Next, the Pregnancy Care Center, located in Wexford, has a support group for young moms. There are also free stores of Pittsburgh in multiple locations that provide free items to those in financial need. These items include infant clothing, diapers and wipes, books, strollers, car seats, cribs, gates, and much more. Additionally, there are other resources around Pittsburgh that provide discounted or free items to new mothers, such as select Catholic charities, Welcome Little One, The Helping Hand, the Pittsburgh Toy Lending Library, and infant care supplies. Finally, by calling the number 211, you can be connected with an agent who can help connect you to resources near you. You can get referrals for things like housing, food, clothing, childcare, educational programs, and family resource centers.
Now we want to emphasize that while you are taking care of your baby, you should also be taking care of yourself. This is so important so that you can best take care of your new baby and enjoy this time in your life. I want to touch on postpartum depression. Postpartum depression is feelings of emptiness, emotionalness, sadness, feelings of disconnectedness and inability to care for your new baby, thoughts of harm to yourself or the baby, change in appetite, lack of energy, etc., for more than 2 weeks after your baby is born. You should not be ashamed or embarrassed of these feelings because you are not alone. You do not have to suffer through this. Actually, 1 in 9 new mothers experience postpartum depression. If you are having thoughts and feelings similar to this, it does not make you a bad mother in the slightest. You should reach out to a pediatrician, doctor, and/or loved ones to receive the care that you deserve and need. In addition to receiving care, here are some things that you can do for yourself that can also help you through this time. Try and rest regularly. When your baby is napping, it is okay for you to also nap. Don't be afraid to ask for and seek help. This can be a stressful and unfamiliar time for new mothers, and you are not expected to do this all on your own. Try to make time to do things that you enjoy, no matter how big or how small. Share your experiences with friends and families. Talking this through can be a very therapeutic experience and grant your loved ones the opportunity to offer assistance as best as they can. And finally, talk to other mothers about their experiences through childbirth and being a new mother. Whether it's through a support group or families around you, people have plenty of advice and experiences to share for you to learn and grow from. A suggestion to make sure you are taking care of yourself the best you can is to make a checklist of things you know you have to do every day to hold yourself accountable. This can include, but is not limited to, eating healthy, taking a shower or completing your self-care routine, drinking the proper amount of water, getting up and exercising or moving around, whether this be a walk or a quick yoga or stretch. And finally, it is so important for you to get some sleep. Again, you don't have to go through this alone. Our last thought for you as a mother of a new baby is to be kind to yourself. Cut yourself some slack when mistakes are made and learn and grow from them. You are not expected to be perfect, and try to realize all of the amazing things you are doing each and every day for you and your baby. We hope this information helps you on your journey to being the best mom you can be, and thanks for watching.